Have you ever noticed that regardless of what you try, regardless of how many times you clear your throat during the day, that uncomfortable, heavy sensation deep in your throat just refuses to stay away? That sticky, clinging feeling, as if something has taken up permanent residence there and never fully disappears. You clear it first thing in the morning, and by lunchtime it has already returned. You clear it right before a conversation, and within just a few minutes, it is back again. You have reached for warm teas, spoonfuls of honey, soothing lozenges, and over-the-counter syrups, and yet nothing seems to offer lasting, dependable relief. And perhaps the most frustrating part of all is that whenever you bring this up to people, the response is almost always the same tired line. "Oh, it is just mucus. That is completely normal at your age. Do not worry about it." Well, today I am here to tell you something entirely different. Persistent mucus in your throat is not something you must simply accept as a normal part of growing older. There is a real cause hiding behind it, and once you truly understand that underlying cause, the path to relief becomes far clearer and far more achievable than most people ever imagine. I am Dr. Mandell, and today we are going to have an honest conversation about persistent throat mucus, what is actually driving it at a deeper level than most explanations ever dare to explore. We will cover 4 specific causes that most people, and honestly, even many healthcare providers, completely overlook. And I will give you a practical step-by-step plan that you can begin putting into action today to address it naturally. Over my 15 years of clinical practice, I have worked with hundreds of patients who lived with chronic throat clearing and stubborn mucus for months, sometimes even years, without ever truly understanding why. Today, I want to change that for you. Before we go any further, I want you to leave a comment below right now and be honest with me. How long have you been dealing with this persistent mucus or that constant urge to clear your throat? Just give me a rough estimate. I personally read every single comment, and today, your answer genuinely matters to me. And if anyone has ever told you that it is simply because of your age and that you should just learn to live with it, please add the word dismissed to your comment, because I want to know how many of you watching have received that completely unhelpful response. Now, let me start with something important that I believe most people have never heard explained clearly. Because understanding this one concept completely transforms how you think about mucus. Mucus is not your enemy. I want you to truly let that sink in. Mucus is actually one of your body's most sophisticated and vital defense systems. Every single day, your body continuously produces a significant amount of mucus, and it does so for excellent reasons. Mucus traps dust, airborne particles, bacteria, and viruses before they can penetrate deeper into your airways and lungs. It keeps the delicate lining of your respiratory passages moist and protected. It is literally the first line of defense for your immune system, working silently and continuously, 24 hours a day. The problem is never the mucus itself. The problem begins when that normally thin, fluid, and manageable protective layer becomes thick, sticky, and difficult to move. Instead of flowing smoothly through your system and being cleared away naturally, it starts to stagnate, build up, and create that persistent, uncomfortable sensation in your throat. The one that sends you reaching for a glass of water or clearing your throat dozens of times throughout the day. So what causes this mucus to change from a helpful fluid into a troublesome, sticky glue? Let me walk you through the 4 most overlooked causes, starting with the very first one. The first cause is something called silent reflux. Now, most people have heard of acid reflux or heartburn, but silent reflux is different because it often happens without any burning sensation in the chest. This is why it is called silent. You may have no idea it is happening, especially while you sleep at night. Here is what is taking place. The valve that sits between your stomach and your esophagus can become weakened or relaxed, particularly as we grow older. When you lie down flat, that small amount of acid and digestive enzymes from your stomach can travel upward, not always far enough to cause heartburn, but far enough to reach the delicate tissues of your throat and voice box. Those tissues are not designed to handle acid the way your stomach lining is. So, in response to even tiny repeated exposures to acid, your throat begins producing excess mucus as a protective coating. Your body is trying to shield and soothe the irritated tissue. This is a completely logical and appropriate biological response. But when the underlying acid exposure continues happening night after night, the mucus production keeps getting triggered again and again. And no amount of throat clearing or honey-based drinks will ever address the root cause, because the real problem is the acid reaching your throat while you sleep. Some research suggests that silent reflux is a far more common cause of chronic throat symptoms, including persistent mucus, than most people and even many healthcare providers realize. If you notice that your throat feels worse in the morning than during the rest of the day, if you experience more throat clearing when bending forward or lying down, or if your voice sometimes sounds hoarse or different, especially in the morning, these are patterns genuinely worth paying attention to. The practical approach to silent reflux begins with two simple but highly effective changes. First, try not to eat within 3 hours of going to bed. When your stomach is still actively digesting food and you lie down, the physical position alone makes it much easier for stomach contents to travel upward. Giving your body 3 hours of upright digestion time before lying down can make a meaningful difference. Second, slightly elevate the head of your bed, not by simply adding another pillow, which only bends your neck and can actually increase pressure on the stomach, but by actually raising the head end of the bed several centimeters, using a small wooden wedge or risers beneath the legs of the headboard. This gentle and consistent incline uses gravity to help keep stomach contents where they belong throughout the night. Pro tip number 1. If you regularly take anti-inflammatory medications for joint pain, arthritis, or other chronic discomfort, please discuss this specifically with your doctor in relation to your throat symptoms. Certain commonly used anti-inflammatory medications can relax the muscular valve that separates the stomach from the esophagus, making it easier for stomach contents to travel upward. They may also reduce the stomach's natural protective lining. Both of these effects can contribute significantly to silent reflux in people taking these medications regularly without realizing the connection to their throat symptoms. The second cause is something called post-nasal drip, caused by chronic sinus congestion. This is one of those causes that many people with persistent throat mucus are living with without ever identifying it, because it does not always produce the dramatic symptoms most people associate with sinus problems. Sinus congestion does not always mean severe pressure headaches or intense difficulty breathing. In many older adults, chronic low-level sinus inflammation simply causes a steady and quiet drainage of mucus down the back of the throat, especially while lying down at night and during the early morning hours after waking. You go to bed, and while you sleep, the mildly inflamed sinuses that are producing excess mucus slowly drain downward due to gravity into the back of your throat. Then you wake up with that thick, uncomfortable feeling and the immediate need to clear your throat before even taking your first sip of tea. Many people experiencing this have been buying antihistamine tablets from the pharmacy for months, assuming they suffer from ongoing seasonal allergies. But in many cases, these medications only dry out the mucus temporarily without addressing the underlying inflammation. And dried, thickened mucus that becomes harder to move is often even more uncomfortable than the original problem. One of the most genuinely effective approaches for this cause is regular nasal rinsing with a gentle, warm saline solution. A simple mixture of warm, previously boiled water with a small amount of plain salt can be used to gently flush each nostril once or twice daily. This helps wash away inflammatory irritants and allergens, reduces the congestion driving the postnasal drip, and keeps the mucus thin enough to be cleared naturally. It sounds remarkably simple, and it is, but the consistency with which it produces real improvement in people who use it regularly genuinely surprises most patients who try it. Tell me in the comments right now, have you ever tried nasal rinsing? And if so, did you notice any improvement in your throat? I want to know because your experience may encourage someone else watching to try something they have been hesitant about. I read every comment and I genuinely want to hear from you. Pro tip number 2. When doing nasal rinsing, always use water that has been boiled and then cooled to a comfortably warm temperature, rather than using straight tap water. Tap water in many areas contains trace microorganisms that are completely harmless when swallowed, but they should not be introduced directly into the nasal passages. Using boiled and cooled water eliminates this concern. Also, add a very small pinch of bicarbonate of soda alongside the salt in your rinsing solution. Bicarbonate helps neutralize acidity inside the nasal passages and supports the thinning of mucus more effectively than salt alone. The third cause is one that surprises almost everyone when I mention it. Yet once you understand it, the connection makes complete logical sense. Certain medications that many older adults take regularly can directly contribute to persistent throat mucus, either by promoting reflux, drying the mucus and making it thicker and stickier, or triggering a reflex that increases mucus production as a side effect. One specific category worth knowing about is a class of medications commonly used for blood pressure management. Some people taking medications in this category develop a persistent dry throat clearing sensation, along with increased mucus production as a documented and recognized side effect. The mechanism involves a naturally occurring substance in the body that these medications allow to accumulate, and in some individuals, that substance triggers an irritation response in the throat. If you take blood pressure medication and your persistent throat mucus began or worsened around the same time you started that medication, this connection is absolutely worth discussing with your prescribing doctor. There may be alternative medications in a different category that control blood pressure just as effectively without causing this particular side effect. I want to be absolutely clear here. Please never stop or change any prescribed medication on your own. Always have this conversation with your doctor first. What I am saying is that this connection exists. It is medically recognized, and it is worth discussing if you suspect it may be relevant to your situation. If this information is opening up new possibilities for understanding what has been happening with your throat, I want you to hit the like button right now. It genuinely helps me reach more people who need this information. And if you are not yet subscribed, please subscribe now and hit the notification bell so you never miss these important health conversations. The fourth cause is the combination of environmental irritants and inadequate hydration. These two factors often work together, and their combined effect on throat mucus is far greater than either one alone. Air containing tobacco smoke, whether from your own smoking or from regular passive exposure, damages the tiny hair-like structures in your airways that are responsible for sweeping mucus upward and clearing it naturally. Even if you stopped smoking years ago, the recovery of these structures is gradual. Other environmental irritants, including wood smoke from fires, strong cleaning product fumes, heavy traffic pollution, and dry heated or air-conditioned indoor air, all create ongoing low-level irritation that triggers continuous mucus production as a protective response. Dehydration significantly worsens this situation. When your body is not adequately hydrated, the mucus it produces becomes noticeably thicker and stickier. Think about the difference between honey straight from the jar during cold weather and the same honey after being slightly warmed. The composition is identical, yet the consistency changes dramatically. Your mucus behaves in a very similar way. Well-hydrated mucus remains fluid and easy to clear naturally. Dehydrated mucus becomes thick, sticky, and more likely to accumulate in the throat rather than being removed efficiently. And here is an especially important point for older adults. The body's thirst mechanism becomes less reliable and less sensitive as we age. You can be meaningfully dehydrated without actually feeling very thirsty. This means that if you are waiting for thirst to remind you to drink water, you may consistently remain in a state of mild dehydration without even realizing it. A practical hydration target for most adults is around 30 milliliters of fluid per kilogram of body weight each day from all sources, including water, herbal teas, soups, and fruits and vegetables that naturally contain high amounts of water. Pro tip number 3. Start every morning with 1 or 2 glasses of plain warm water before anything else. Before coffee, before breakfast, and before taking your morning medications, warm water first thing in the morning activates your digestive system, begins the rehydration process after the overnight fasting period, and immediately starts thinning and loosening the mucus that accumulated in the throat during the night. This one simple habit costs absolutely nothing, yet many people report that it creates one of the most noticeable improvements in their morning throat clearing. Plain warm water before anything else every single morning. Now, let me also address a few common remedies that unfortunately do not work as well as many people hope. Sugar mixed with lemon is a popular home remedy, but sugar is actually dehydrating and can pull moisture from the tissues of the throat, potentially making mucus thicker instead of thinner. Honey does have genuine soothing properties and can help calm irritated throat tissue, but it does not address the underlying causes of mucus production. Dairy products do not create mucus from nothing, as is sometimes claimed, but in some people, certain milk proteins can create the sensation of thicker existing mucus, especially if there is an underlying sensitivity. If you notice that dairy consistently worsens your throat symptoms, it may be worth reducing it temporarily to see whether you experience a meaningful improvement. Now, let me bring everything together into a simple, practical plan you can begin today. Tonight before bed, make sure your last meal is at least 3 hours before sleeping. Raise the head of your bed using a simple wedge beneath the legs of the headboard. Drink a full glass of warm water before bed. Tomorrow morning, begin your day with 1 or 2 glasses of warm water before consuming anything else. This week, purchase a simple nasal rinsing device from your pharmacy and begin using a warm saline nasal rinse every morning and evening. Make an appointment with your doctor to review your current medications, specifically in relation to your throat symptoms. Ask whether any of your medications are known to affect mucus production or may be contributing to acid reaching the throat during the night. And finally, commit to staying consistently hydrated throughout the day rather than waiting until you feel thirsty. Your throat has been trying to tell you something for a long time. Persistent mucus is not simply an unavoidable part of aging. It is your body's signal that something related to your environment, meal timing, sleep position, hydration, or medications, deserves attention. Now you have the information needed to respond to that signal intelligently rather than endlessly managing the symptom day after day. In my next video, I am going to discuss 5 specific foods that some research suggests may actively support throat health and naturally help reduce airway inflammation in adults over 60. You will not want to miss that discussion, so please make sure you are subscribed and that your notification bell is turned on. If this video gave you something genuinely valuable today, please share it with someone you care about who has been struggling with persistent throat clearing and has been told it is simply because of age. That one share could truly make a difference for them. And remember, this video is for informational and educational purposes only. Always consult your personal doctor before making changes to your health routine. If you found this video helpful, do not forget to subscribe to the channel and hit the notification bell so you never miss an important health tip. See you in the next video.